When I upload it, I just put a thumbnail. Yeah. Okay. Just picked up customer Owen. He's involved in what is it you do?
So I'm currently on placement doing cardiac rehab in the hospital.
Okay, cardiac rehab.
Yeah, so
Okay.
people who've had heart attacks or cardiac arrests, or they've had open heart surgery, obviously their recovery process is quite difficult and long. So they come into these group classes and we exercise them to get them back on their path really before they had that event.
Okay. Okay. And what's the type of program you'd implement for someone who's okay? First of all, prevention is better than cure.
Exactly, yeah.
What would you advise people to do to try and stay on top of things in their life to prevent an heart attack? I mean, that's a big question. It could be a range of things: diet, regular checkups.
Exactly that. So we advise a Mediterranean diet, so lots of
Interesting.
oils, different healthy fats, lots of fibre, fruit, veg. Obviously, prevention is better than cure, but unfortunately, we do get different patients that have followed the rule book all their life and they've still had an event, so it is difficult. Obviously, they've got a lot better chance of recovery after that as well. So it is still best to be preventative with diet, like you say, regular checkups, regular exercise, like cardio exercise and resistance exercise, as well as flexibility. So we recommend like 30 minutes of moderate to vigorous exercise 5 times a week, so 150 minutes per week.
Okay.
So
that's interesting. There's a guy, have you ever heard of the Piope diet? Or Piope or Piope? Okay. It's from Italy, I might be pronouncing it. But there's a guy called Dr. Asim Malhotra. He was like he is or was TV celebrity. Okay. But the reason I mentioned it in context of the Mediterranean diet, because he wrote the book, the Piope, and what he said is that the Mediterranean diet, I think his name might have been Axels or Anxels, so where the original Mediterranean diet come from. But the reason he read the book is what he said, we got a bit of a skewed version of it. Right. So we done, according to him, once again, just a perspective, it's pretty similar, but he read the book because Piope was the place in Italy where it originated from. So he goes in depth and covers in more detail like kind of what he spoke about, which is very similar, but he goes more into, like, for example, it's not just the diet, it's the social elements, it's the walking, it's the exercise. I think in Piope as well, they don't even have gyms, or they didn't at that time. So it's really powerful book as well, and he, at the end of it, he gives you like a bit of a blueprint. And what I liked about the book as well, it goes into like, because I don't know, he talks about like certain Tai Chi exercises doing on a regular basis. What else does he go into? But it's good because everything he recommends, he goes in. So if he says, well, have tomatoes or this or that in your diet, he goes into exactly the science on what it's doing. But yeah, it was just interesting that you mentioned it. And like you said, a lot of people will follow the rule book, and I think sometimes there's a bit of negativity in the sense of, like what you just said, I think it's good to tick the boxes regards prevention, because some people say, well, you can be the fittest person and something can happen. Exactly, yeah. And I get that, but your odds are going to be a lot better if you do all of the advice, what you said. Definitely. Get the exercise, have a good diet, tick as many boxes as you can, and still have like checkups, like what you're mentioning. And like, for example, what's it called? A friend of mine had an heart, something to do, high blood pressure, and he ended up having like a heart problem, something to do with his aorta, is it?
Aorta, yeah.
Aorta. But like what you said, I think they call that a silent killer, because you feel perfectly fine, exactly, and unless you're getting your checkups, you're never gonna know. Exactly. Which goes back to what you're saying, just try and tick as many boxes as you can, and
I think they have a lot more positive mindset about their recovery as well, because obviously they've experienced exercise throughout their whole life. They've got that positive relationship with it, so I think psychologically they approach their recovery a lot better as well.
Who? Sorry.
the patients that have ticked those boxes of prevention throughout their life.
Yeah, definitely, yeah.
So yeah, I think they have a lot more positive outcomes anyway because they have that positive relationship with exercise. So yeah, I think the psychological side's big for it as well.
Okay, yeah, no, definitely. And like, why are you so? Because you're you're passionate about it, and that's what I like to capture as well. I think you said you suffer from.
Yeah, so I'm going into sleep and respiratory physiology, and I've always been interested in respiratory because I grew up with asthma from a very early age, and I've recently had placement in that area as well. So yeah, that's kind of sparked my passion for it, and it's like further ignited that really through placements and like hands-on experience in that as well.
Okay, no, there was just something I want to. Okay, yeah, just so it's a book and reading from doctors,
Okay.
yeah, food, better medicine.
Right.
Once again, it's a perspective, yeah.
Yeah.
For me, I think you'll always need medicine, yeah. You shouldn't be polarized. And he's a doctor. It's a group of doctors, stuff like that. Dr. Michael Dixon, chairman of the NHS Alliance. So they've got some credentials,
Yeah.
but just something I'd like to mention to you before you get out as well. But yeah, we'll revisit that in a minute. So yeah, so it's interesting and it's nice to, like you say, even if you won the lottery, you'd still pursue.
Yeah.
I think you said you had asthma.
Yeah.
Okay. What's the? Is that the reason why you got into it? Since you've
so
got into it,
I just felt like I could, because I've experienced like the healthcare system from both sides really, like through placement as a provider, and then on the other side as a patient as well. I could, I don't know, just be more genuine with patients.
Okay.
Not relate to them because obviously my condition hasn't been that severe, but just show that compassion a bit more really, I think, which is quite important in the NHS.
Turn right on Queen's Drive, Stony
In
Croft.
terms of the NHS values, that's like what they look for really. So,
Okay. No.
yeah.
Yeah, it's priceless. See, regards heart attacks, I don't know, there's a bit of mixed opinions. Have they gone up over the last few years, especially since COVID, which can be a range of different reasons, just lifestyle, lack of hospital appointments, etc., etc., or is it declining? Are we getting on top of things?
I think it would be hard to say because obviously the NHS is stretched since COVID across all areas really. But no, with me not going into the cardiac side, I'm not sure on numbers.
Okay.
But I would assume that today's diet, I think also age ranges as well, because I think a lot of people my age are focused on their health a lot more.
Yeah, definitely.
Much more than the older generation were at this age anyway.
Yeah.
In their 20s. So yeah, I think it would vary a lot on age ranges as well. And then obviously as we go through the generations, as they go through the healthcare system, I think that would vary a lot. So yeah, I'm not sure on actual numbers, but
No, interesting. From your experience in what you specialise in, do you see more young, mid-aged or older people?
I think the typical like kind of patients that we see obviously get across the board
In a
really.
quarter
But,
mile, keep left to stay on
yeah, it would
Queen's
be
Drive,
more
Stony
middle-aged,
Croft,
older
using the
patients
left lane.
with the higher BMIs that you would see, particularly for obstructive sleep apnea. That is caused mainly by what you said.
Yeah, I thought I snore a lot. I thought I might have had. I think I got looked into a while ago, but I don't think I have. But I snore a lot, and sometimes I'm terrible for yawning.
Right.
And I'm thinking because if I sleep on my back, sometimes I wake up with a shock.
Turn
So I
left to
think
stay
that's
on
why
this road.
I got looked into.
Yeah.
But I don't think I had it in the end.
Okay.
But I think because I snore so much, I'm always yawning. But a few people have said, "Oh, it could be sleep apnea."
Yeah.
But at the
Just
moment,
ahead,
it's not a
take it
problem,
straight
to be
through the
honest.
roundabout onto
But
East Road.
it can be a bad condition to have,
Yeah.
like, can't it? You'd have to have equipment and stuff
so
overnight.
The first line of treatment is a CPAP machine, which just provides a constant positive pressure of airway. That just keeps the airway open, so it stops it collapsing once there's
Continue straight through
obviously
the
you get a lot
roundabout
better
onto
quality
East
sleep
Road.
then. So
Okay. we're going to be getting out in a few minutes, but I'm glad that you agreed to it, because like I said, as the channel grows, it's just good to, you know, I had a personal trainer in the other day. You know, he's done it 45 years. I haven't uploaded his video yet, but he's like the face of Pure Gym. And it's good to just get different perspectives and free consultation. A few years from now, Owen will be charging us for this privilege of having a chat. So that's the good thing about being a taxi driver. You get the luxury of getting a freebie. But yeah, is there anything else you'd like to say before we bring it to the close?
No, that's been great,
Definitely, but yeah, Owen's got that spark, that drive, that energy, that motivation, and definitely to help people. I had a girl in the other day, Combat Barbie, dead young like yourself, was going into law, then went into SEN, because she just felt like she wanted to do something more that gave her a sense of purpose. But then she's also an army medic as well, done all the training and like prepared to just, if she gets that call, drop of a hat. A lot of her family have got a background in like World War World War II, but it's inspiration to capture that energy, whatever it is and whatever it is people do. But thank you for that, Owen.
No worries.
Just gonna bring that to the close. Pleasure.